Hello, everyone. Welcome to the Lancet Webinar on Medical Research as a Catalyst for Policy and Societal Change. This webinar is part of a series of webinars where we are holding throughout the year in celebration of the Lancet's 200-year anniversary. And the topic that we will discuss today is perfectly aligned with the Lancet's foundation. The journal was founded by Thomas Walkley 200 years ago. And Thomas, who was a surgeon, had this idea and this aim that his journal, the journal that he was founding, should be a tool to make sure that medicine could be used to drive transformational societal change through advancing medical and research in science. And today's topic is also aligned with the context of the United Nations World Science Day for Peace and Development, which is celebrated tomorrow, and highlights the important role of science in society and the need to engage with the wider public in debates on emerging scientific issues. So I hope that you are all set up and enjoy our conversation today. We have a really nice panel of for discussion next, and I'll hand over to my colleague Vanya for the housekeeping announcements and the agenda.
Executive editor at the Lancet, and it's a pleasure to be here today with a great group of panelists to discuss a very important topic to us. So just to give you run through quickly through the agenda today, I have a little bit of housekeeping to do after these opening remarks. Then we'll have the format of the webinar will be a roundtable discussion with 4 panelists that I will introduce shortly. This will last about an hour. After the 1 hour roundtable discussion, all of you in the audience will be able to take part to the live Q&A questions. And please feel free to type in your questions in the Q&A box. And I'm not sure we'll be able to, whether we can go through all the questions, but we'll try to address as many questions as we can once we get to the end of the roundtable. And finally, we'll wrap up with the closing remarks. So, yes, I think this is in this slide, you can see the box where you'll be able to enter your questions. You can adjust or minimize any of the boxes that appear on the webinar dashboard to suit your preferences. The webinar is being recorded, so a link to the on-demand version of the webinar will be emailed once the webinar is concluded. And once the webinar has ended, please complete, it would be great if you can complete our very short feedback survey so that we can continue to improve our webinar offering. So today we have a great lineup of speakers, and I apologize in advance for those of you that would be expecting to see Dr. Sumaya Swantanam. She was unfortunately not available to join us, but we are equally delighted to have Dr. Padma C taking place in this panel as a last-minute change. So very quickly, I would like to introduce Dr. Joseph Ravenel, who is a clinician based in at Langone House, New York. Neil Packham-Walsh, who is the coordinator of Health Information for All, based in London. Dr. Padma C, she's a clinician and currently director of the National Institute for Research in Tuberculosis in India. And Dr. Vivian Lin, she is based at the University of Hong Kong, and she's professor of public health. Good welcome to you all. And I would please invite all of you just to shortly let let us know what are your main areas of interest and experience, please. Joseph.
Hello, everyone. It's a pleasure to be with you on this panel. I am an associate professor of population health and medicine. My research interest is community-engaged approaches to achieving health equity, particularly for minoritized populations here in the United States.
Thank you. Neil, would you like to introduce yourself?
Thanks, Vanya. Yes, I'm Neil Pakenham-Walsh. I coordinate the Healthcare Information for All, which is a global health network looking to improve the availability and use of reliable healthcare information with a particular focus in low and middle income countries. And since last year, we have been in official relations with the World Health Organization.
Thanks very much. Padmasi?
Hello, I'm Padmapriya, clinician by training. I work with patients with tuberculosis, both drug sensitive and drug resistance in India. My area of interest is new drug trials and vaccines.
Thank you. And finally, Vivian, could you introduce yourself?
Thank you very much. It's a great pleasure to be here. I'm currently the Executive Associate Dean at the Faculty of Medicine at the University of Hong Kong, previously also with the World Health Organization. My interest is public health and global health policy, and I see the central issue as what is the relationship between evidence and decision-making for the public good.
Thanks so much. Really delighted to have you all with us today. I think we'll move on quickly to start our roundtable discussion, and Thaisa will kick us off with the first question.
Well, thank you, Vanya. Well, I think I'm going to use Vivian's last sentence to start our conversation, because this is exactly why we're here today, right? And so my first topic that I would invite perhaps Neil, Vivian, and Joseph, I think you could give your ideas on this science and communication topic that we discussed a lot recently, and how that we do the communication to make the research effective. So we have research, but how do we make academics communicate their research in an effective way that it can actually translate into facilitate the community engagement, for example? Just, perhaps I think we lost Joseph for a second, so I'm going to move. Oh, hi, Joseph. I think you're back. I think this one can go to you. So how do you think we engage with academics to make this communication of their science more effective to engage communities, for example?
Thank you for that great lead-in, Vivian, your last statement about the essential question of how do we ensure that medical research can best be used for the public good. And I believe a big part of how we ensure that medical research is effective at advancing the public good really is thinking about how do we communicate our research findings. How do we take the evidence that we develop and communicate it not only to the public, but to policymakers and decision makers. I know that in my clinical training, I was taught how to communicate with patients about medical conditions, about ensuring that they know, how to take their medications, that they understand their disease processes. But we really weren't taught, how to communicate with policymakers, how to communicate to advance advocacy. And so I certainly think that because we have incredible modalities for communication these days, including social media, I do believe that part of the core part of training clinicians and scientists really should include not only how we communicate with patients, but also how do we communicate with other audiences, including policymakers and decision makers.
Yes, definitely. I think it can be a curriculum idea change for med school. And it might also be related to a division of a clinician and a researcher. I don't know if you agree with me. So those that are doing the actual research perhaps are the ones that are in this gap. Also, I think, Neil, you may have an opinion on this one, but do you see that new tools that can be used to accelerate this progress, like AI, machine learning, other open channels of communication of science, how do you see this playing in this universe of making science communication more effective?
Well, thank you, Taysa. I agree with what Joseph said, and that it's obviously very important for researchers to be able to communicate the results of their research. But I would also ask researchers to have the right motivation. I think that the purpose of research in this area is to support evidence-informed policymaking. And we should remember that, as Doug Altman, the statistician, said, most studies are wrong. And therefore, there is a danger that what we call effective research communication can actually undermine evidence-informed policymaking. So I would ask researchers to think in terms of their position in the global evidence ecosystem and not necessarily be motivated by having their findings put into practice, because very often that is not necessarily the best way to go.
I feel a lot of head shaking. Yeah, that's definitely true. And on that note, how do you think that successful communication would look like in that sense that you just put it? Do you have an idea of how we should be doing this instead?
Well, I would like to see us talking not so much about science communication, as in communicating the results of a particular study, but rather in terms of, are we meeting the information needs? Are we making sure that individuals and policymakers have access to reliable information? And science communication is only one small part of what I would call the global evidence ecosystem, which includes researchers, publishers of journals, reviewers, systematic reviewers. I think that systematic reviews, when done well, are a really important aspect of evidence-informed policymaking. And then, of course, all the people who are involved in packaging information in different formats and different languages for different audiences. and the library and information professions for helping people to find the evidence that they're looking for and to be able to tell the difference between reliable information and unreliable information. So my hope would be that we look at this as a whole systems issue and that we achieve a better system going forward so that in 10 years' time, we can look back and say the global evidence ecosystem is better now than it was 10 years ago.
That's wonderful. Does anyone else have any points to make on what Neil and Joseph just said? I really like what you said about moving away from communication single findings and putting that in the perspective of, is this the evidence that should be being pushed forward?
Yeah,
I think that clinicians are actually better at communication with the general public than the scientists who work in the labs, perhaps because the scientists don't need to. And so you can always train people, but sometimes that's not the best way to use their skills and for them to spend their time. So having good communicators who can actually be the broker between the scientific evidence and the desired audience, I think is often quite helpful. Because I think when you're thinking about communication, obviously, even when you think about the community, there are many different types of people in the community that you would want to communicate differently with. And so the same thing, policymakers are not a monolithic group. And how you frame is very important issue. How you understand their context, how you understand their interest. So I think having people who are specialist communicators and also really understanding the decision-making ecosystem is very important part of effective communication.
That's definitely another point on our problems to be solved. And Vanya, do you want to take over to the next round?
Another topic I think important in this conversation, another element important in this conversation is the role of the local communities. I think, not only the researchers need to understand better the communities, but also we also need to learn from the communities. It's a two-way process. We also need to learn from the community what are their problems and how to turn the community problems into researchable problems to help researchers develop research that is more that meets the interests of the populations they are serving. Dr. Padma, would you like to give us your perspective, how you think we could help communities to turn their problems into researchable problems?
Yeah, thank you. Thanks for that question. I would say I would like to start with an example of how the community problem can be converted to a researchable question. With PV as my research background, one thing I would say is the long duration of treatment. The treatment duration goes on from 6 months to even 12 months. And the community find it difficult to complete the treatment, adherence or drug compliance. So the community feels a shorter duration of treatment to be very helpful. I think so researchers should start thinking of, can we give them a 6 months shorter duration of treatment rather than with long durations, but with more adverse effects? How can it be made more friendly, less of adverse events? So I think rather than top-down approach, if we have community advisory boards to guide our trials and clinical studies, kind of listen to what the community would want from the researchers. That would help us make better research questions.
I don't know. I'm struggling a little bit to hear you. I hope our colleagues can hear you better than me. But maybe I would also like to hear, Joseph, you have a large experience of working with communities and trying to understand their problems. What would be your views on how to improve this the connection and relationship between communities and researchers?
So I absolutely agree with Dr. Padma C that we really need to focus on, how do we create the best research questions, particularly ones that are going to be relevant and potentially adopted by our communities and our audience. The way to do that is to engage them from the very beginning and actually forming and prioritizing what those research questions are. Historically, medicine and scientists have often, in a more insular way, sort of set a research agenda, often without the input of communities. And so it should be no surprise when we develop research findings and we have new evidence that it's not always understood or adopted by our communities. But I think one way to ensure that we have community buy-in is to involve them from the very beginning, going out into communities and asking, what is important to you, and then taking what's important to our communities and aligning that with the important issues that we know from a scientific perspective. This approach has been utilized in many different contexts. Here in the U.S., it's a framework called community-based participatory research, which means that we really do solicit participation and engagement from the community at every stage of the research, and not just at the end when we want to disseminate our findings.
Thank you, Joseph. And I think what you're saying is reminding me of the importance of this year's UN Science Day tomorrow, which the theme is trust in science. So I think the importance, another reason why it's important to work with the community is really to rebuild trust in science with those that, in particular after COVID, trust in science has been a bit shaken up. Maybe, I don't know, Dr. Padma, you also work a lot with communities. What do you think, do you have any examples of initiatives that, or, programs that try to build trust in science, and what it should look like? In which form should we try to build trust together with the communities?
Yeah, thanks. That's a great question. I think, the survivors of the disease or disease survivors, they could be a great champion to push the cause of the disease. Use them as counselors. One example in the world of TB, we would say TB champion. So patients who have been cured of TB, we call them TB champions. And we take them along to be a peer motivator or counselor. So when new patients are diagnosed or put on treatment, these TB champions motivate them to complete treatment. and kind of give them support, saying that, we won the disease, so you too can do it. So this kind of gives more in terms of patient-centric approach. And so the patients start building a trust towards the healers or the physicians. It's easy to bring in new regimens, new vaccines when you take the survivors on board with you.
Of making the community feel resonate with the success of being involved and the success of what the research can bring to them. I guess another important part here to make research more effective is the policies. So how to mobilize evidence for effective policies, I think is the another important part of the question, and I will let Thaisa lead us on the conversation under this topic.
Thanks, Vanya. I'm just going to open this to Neil. I think you mentioned that you have a contribution to the previous question. Do you want to share with us?
Thanks very much. Yes, indeed, Thaisa. Just to say that on HIFA, Healthcare Information for All, we base our work around discussion forums. So we have 20,000 members interacting about various issues, which include evidence-informed policymaking. And we had such a discussion sponsored by TDR at WHO a few years ago. And that pointed out that CSOs have a lot of different roles, including advocacy, empowerment, and also providing evidence themselves through surveys and so on. But another thing that came up was that some CSOs are more powerful than others and can therefore risk undermining evidence-informed policymaking simply because they have a stronger voice. And one way in which that issue has been addressed in some countries is through national stakeholder councils, so that there is that's also easier for policymakers to take in terms of developing policy, because otherwise they have hundreds of voices and it's difficult for them to prioritize among all those voices. So it's useful to have a collective mechanism, I think, for CSOs. And a last point is that CSOs, of course, are incredibly varied, and that even the definition of CSO varies from one person to another. For example, some people in our discussions suggested that CSOs were not just organizations, but individuals can represent civil society as well, without being affiliated with an organization.
Absolutely.
Yeah. Well, I'm going to change gears just a little bit, but not too much. But I want to go a little bit further into our discussion of what evidences are we talking about when we're looking into policy. So what I mean by that is there is a sense that there is discussion in several fields, and I can tell specifically from some minoritized populations field that there's a feeling of we're done with redefining the problem through research, and there's a lot that we already know about problems, but the research should be guided towards knowing the problem, what are the solutions or the possible solutions for that. So I would like to hear a little bit from you, Vivian, and your experience on that translation part of the research, and how how do you communicate with the researchers the need to how the focus of the research can make it more translatable or not?
On every single researcher to fit. Am I?
Yes, you're good.
I don't think we want every single researcher to shift their research program in order to influence the policymakers. Quite often we need a team of different kinds of researchers to actually work together, because there are researchers who are good at describing the problem and others are good at planning and delivering interventions. And some are good at evaluation, and that evaluation could be about health outcomes, but that evaluation could be about the costs. So I think, you know, policymakers will require a lot of different kinds of evidence, and ideally cumulative evidence, so it's not a single study before they're comfortable. So linking back to the previous question, I think one of the really useful things for researchers is to actually engage with community service providers and policymakers, saying, what's the problem you're trying to solve? Because policymakers have many different problems. And so the challenge is then to translate that into either a research translation plan, because the research has already been done, or to translate that into a research question so that you can do research that actually is relevant to the practical problems that are being resolved. And I do think it's quite important for policymakers to not just look at health outcomes. I mean, it does depend. For instance, you know, the advocacy around cancer screening programs came from scientists and clinicians who knew that there was a way in which breast and cervical cancer could be detected early and you can get to better outcomes. Now, the policymakers don't sit there and think about this issue, but by getting the grants, doing the work, showing the kind of results you get over time, then you can say to the policymaker, you realize this is the leading cause of death amongst women, and do you realize there's actually a solution? This solution is going to cost you this much, but what you have to do is to set up a system which has a certain, you know, screening interval, which has a certain population coverage. So you have to package up your solution. Now, that's a relatively focused one. But if you go into something that which is more systemic, you know, researchers have looked at the proportion of people who fall into poverty because of out-of-pocket healthcare costs. But in some ways, there are so many different kinds of possible solutions. So you might, you know, experiment with different financing mechanisms, different financial coverage mechanisms. But at the end of the day, that decision is likely to be related to ideology, to resource availability, and many other considerations. So if you have a particular solution you want, then you really have to think broadly about the kind of evidence that needs to be brought together. So there's a couple of examples where you really are thinking about different kinds of evidence.
Yeah, that's amazing. And I think this already answers one of the questions in the Q&A box about practical examples of when research is translated to practice. And I think, Joseph, do you want to comment on that, on how the end justifies the research from this perspective of policymaking?
Absolutely, and I can't can't add very much to what Vivian said so well, but I completely agree that, you know, as we are thinking about health equity, right, which is really the notion that everyone, no matter where you live, no matter what you look like, no matter what your background, everyone should have the opportunity to have good health. And as we think about that, you know, from a public health perspective, we have to look more broadly than just simply focusing on the medical condition. And so there are places in the world outside of the U.S. that have that already know this and have actually been sort of focusing on this for much longer than we have. But I will say that that here in the U.S., you know, over the last decade or so, and particularly with what we saw with COVID, where we saw a very large disparity in who was impacted by COVID most. And what we learned was that that it wasn't biological differences that made people more susceptible to harm from the COVID virus, but it really was differences in social barriers that really determined, you know, how well or how poorly people did. And I think that experience here in the U.S. really helped to propel some emerging policies where even in delivering medical care, there are now resources and ways to be reimbursed for actually delving into social barriers, not just delving into them, but also finding a way to address those social barriers, recognizing that that social barriers have a big impact on how well people do in terms of their health. And you can't just focus on someone's blood pressure without also focusing on what access they have to healthy foods, what access do they have to medications that can help to lower blood pressure, what are some of those other competing priorities that have to be addressed in order for us to address that medical problem, which we know can actually have an impact, you know, on people's lives, people's livelihood, and people's quality of life.
Thank you. Vanya, do you want to go over?
Great discussion here. I think I'm thinking about, you know, another issue of making the process of translating research into policy more successful is the political populism. And I mean how very often we see political decision makers thinking about how much time they have left whilst they are in their role, as opposed to thinking on the long term, which is what we need in global health. If we are to improve translation into policy, we need to get politicians to think at a longer time frame. Vivian, how do you think we can address this?
I think at the end of the day, we have to recognize that we actually want bipartisan support for good public health policy. So while in the very short term, as you come up to an election or you come up to a budget announcement, there's various things you could do from an advocacy viewpoint to get a quick decision because it's electorally appealing or, you know, the timing is right. But I think that the research community, the public health advocacy community, need to work collectively to really engage with parliamentarians more broadly, because parliamentarians, you know, they could be running in government, they could be in opposition. They have a role in passing legislation, they have a role in passing budgets, they have a role in scrutinizing government, you know, services and delivery. And of course, they also respond to their electorates. So they're very sensitive to public opinion. So I think the more we can actually have good conversations And I don't want to be, pejorative about researchers knowing more, because researchers know some things and other people know other things. But if we could, educate the politician on the kinds of things that we can offer that will help improve people's lives, then I think we can get a longer term agenda.
Absolutely, absolutely agree with you. So, how can we? I mean, I think you touched on this already, but I was thinking how, to reconcile political interests with the need for evidence-based policy. I don't know if you want to comment on that on this aspect as well.
I think quite often the framing is really quite important. You can approach equity, take that from a value or moral perspective, and take the high moral ground and, ask for action, offer some solutions. You could equally argue for equity-focused solution on the basis of a utilitarian and pragmatic. You could try and get action on non-communicable diseases because of the high burden. You could argue for it in terms of a productive workforce and better for the economy. So I think, you have to be good at understanding what is the imperative driving decision-making and be able to frame the proposition appropriately.
Absolutely. Another issue is also like this. I mean, we've been talking about this a bit, but when we think of the connection between the local communities, policymakers, and healthcare systems, it seems there's a lot to improve here. And again, this is a problem that we see in various areas, the working in silos and the lack of communication across the different stakeholders. Joseph, what are your thoughts on how to improve the conversations and connection between these different stakeholders that can drive, that can improve this decision making?
Great question, and I'm going to piggyback on something that Vivian said, which is, how we frame information is incredibly important here, and I would love to hear Neil's thoughts on this. But as we think about how to influence people's decisions. And this, I think, applies not just to patients, but probably to politicians as well. There are a number of behavior change models, and I won't get into the sort of weeds of it, but there's one that I like, which which I think is relevant here. It's called the Information Motivation Behavior Skills Model, and basically what that model says is, if you want to influence decisions and get people to change their behavior, you need to provide them the information that they need, that basically gives them the context of why, whatever change you're proposing is important. But then one of the most important components is, how do you change their motivation, or how do you address their motivation, right? And as we think about politicians, we know that there are multiple motivators, and so understanding, what are the policymakers or decision makers' motivations, and then how can we sort of frame the information in a way that speaks to that. And so, one example might be, if a politician's if one of their motivations is staying in office or staying in power, right? How can we make them see that that having better health, and by speaking to to the public good can actually have a benefit for them staying in office or staying in power, and then sort of framing the information in a way that they can see that those two things are aligned. The information and the motivations are aligned. I think that's something we can certainly do better. But then how do we do that in a way that also to some of what Neil was talking about earlier, right? How do we do that in a way where we're ensuring that actually there's a balanced presentation of the evidence? And so, but yeah, so I would love to hear Neil's thoughts on this.
Thanks, Joseph. Neil, do you want to comment?
Yes, thanks. Can I just, yes, I completely agree with Joseph and Vivian on their comments. I just wanted to add that we just closed a global survey in official relations with WHO, and one of the results that came through was that there was strong agreement that governments should uphold their obligation to ensure that their citizens have access to reliable information. We've seen in the COVID pandemic that governments are capable not only of not supporting evidence, but of actually undermining evidence and undermining those people in positions at the top of the public health system. So this is something that I would, I hope that in the future, politicians are held more accountable for the ways in which they undermine evidence.
Absolutely. Dr. Padma, I thought that you also wanted to add something to this conversation, did you?
Yeah, I was thinking we should kind of add a piggy bank on the political agenda. If the politicians have a health agenda to promote their interests, that they can be used as ambassadors for either promoting the treatment or promoting the prevention options, make them the ambassadors for those conditions. That's one. And second, it's not all the time research takes to the policy makers. There are other stakeholders, for example, the media, both print media, the electronic media. I think the media people should also be taken on board to get the research finding to the masses, to the public. The other thing is also the private players. You know, we forget the private practitioners, the private hospitals. We think research is all in the public domain from the public hospitals. So I think the private practitioners should also, we should enable them to build trust on the various researchers. So I think it's a collective teamwork. You have the private players, media, politicians. All of them form part of the community. So the community engagement is just not those who are affected. It's a bigger group, and I would think that would drive the research evidence, help it put into better perspective.
Thanks so much. That's I think, very interesting and insightful. Taysa, do you want to take on the conversation forward?
Yes, so I am a little bit mindful of our time. We already have 50 minutes into our discussion, and I really want to have enough time to discuss a little bit about the future. I think what Dr. Parmo was mentioning about the role of the media, and just a final thought around this first topic, and what Neil said about people that undermine public health workers, especially if they have the power, like politicians that have the power, being Brazilian. That's very powerful to me, that what you say about having people that, you know, go against science being accountable for the power that they have over the decisions that are made. And I think it speaks to what Padma is saying about involving the media and how we're going to do that in a way that we ensure that the evidence is being translated in a way that's serving the community and serving who needs to be served, and not the interests of politicians. I think we all agree that in the end, that's who we want to serve with the communication that we're trying to do. So I'm gonna change this into, we're very keen on hearing from all of you a little bit of how, after all of discussed, how do you see that success should look like over the next decade based on our discussion? So I think in your own perspectives, Neil, do you want to start by saying how do you see success in the science communication perspective?
Maybe
Sure,
should we just set a time frame of, say, the next 10 years, what we realistically could expect to be a success within the next 10 years?
Thank you. Yes, I would like to see over the next 10 years a stronger global evidence ecosystem. And I would also like to see within the next year or two, the World Health Organization take its role as the champion of the global evidence ecosystem. The purpose of the ecosystem is to ensure that every person has access to the reliable health information they need, whether they are individuals, health workers, or policymakers, to support health. Because we must remember that access to reliable healthcare information is a determinant of the right to health. And it is, in my mind, the main reason for having the health research in the first place, that people can have that knowledge that they need to improve health.
Great, thank you, Neil. My next direction is to you, Vivian. How do you see success in the next decade in the health policy perspective?
I would like to see infrastructure and capacity increased. Firstly, on the part of the academic institutions in terms of engagement with policymakers and being able to communicate more actively and be more responsive. Secondly, on the part of health service providers, to actually have researchers also embedded in those organizations who can actually work with the data that is generated all the time, so that there is much more real-time understanding of what is happening in the health system. And I would like to see on the policy side that there are research brokers who actually seek out information relevant to policymakers, find the researchers and engage them on an ongoing basis so that there is constant horizon scanning. So that's the first thing. It's about an infrastructure that can knit people together. I would like to see serious funding for health policy and systems research in the global south, and not just being driven by the agenda of global north research funders or researchers. So a real capacity to look at the issues in their context find the relevant solutions. I would also like to see more emphasis on educating people from an earlier period so that children, young people can get really enthusiastic about research and policy research so that we don't get into this, we don't trust science, but to foster a real curiosity and a commitment to bring the evidence into everyday life.
Joseph, I'm curious to hear, what do you see success in the next decade would look like for the engagement with community perspective?
Yes, and I think that what Neil and Vivian have said is very relevant to how we engage communities. Over the next 10 years, I would love to see more of a streamlined process for engaging communities to understand what their health needs and health priorities are. And then for those of us in academic medicine, to potentially be some of those brokers that Vivian talked about, who can help to translate some of those community health needs to policymakers, and us making sure that we are utilizing politics to advance our science and health agenda for the public good, and ensuring that, unlike what we have seen in some cases recently, unfortunately, science or a miscasting of science to advance political agendas, we absolutely have to guard against that. So yeah.
Thank you so much. And Padma, I'm also curious to hear, how do you see success would look like in the next decade from the operational research perspective that you are leading?
Thank you. So I think after seeing what happened in COVID, there will be, I think there'll be more of consumption of science and evidence generated through research. There'll be more community involvement, the demand generation from the community. So they would want to get more vaccines, shorter regimens, quicker treatment, point of care diagnostics. So 10 years down, I think the community would be driving the research. And I would like to see more of funding for this kind of research, where you can answer questions that the community wants, rather than research being driven by the sponsors or where the funding is coming from. I think there'll be more trust between the community and science, especially if we involve the community into our research agenda. So yeah, so that's where I see science and research in the next 5 years.
Okay, I really like your idea of the community driving the research and not the funding driving the research. I think if we get there in 10 years, we'll be a much better society for sure. We're perfectly on time for our Q&A, and let me move on. I do have a starting question as we get acquainted to this. And maybe, Padma, you have an idea of this. We've been talking a lot in the global level here, But I'm interested in hearing from you, and this is the question that has also popped out. How does this translation look in research in low and middle income countries? I think this is the experience that you have with the community and the policy making in resource limiting institution or resource limiting country. How does it look like everything that we talked today in this specific context? Do you see differences? Do you see angles that we should be considering differently?
Yeah, so currently, I think more than 60% of the research in low middle income countries is driven by the sponsors. And very little of what the community needs or what the community wants happens. We are moving now to involving community more. We have community advisory boards and also listen to what they want rather than driving a top-down approach. But this is still a long way to go. And I think it will definitely, I'm sure it will improve over the years.
Well, thank you. Vanya, do you want to take over? Do you want me to go with the next question?
Well, I think Dr. Padma might have got frozen, or is it on my side?
Oh, yes.
Anyway.
Hi. No, I think so.
Yeah. I think we have, I'm reading through the questions that are coming in from our audience. And I think we actually covered quite a lot of the questions during the discussion we have had so far. So we'll try to make sure we cover any topics that weren't included yet. And yeah, I thought this context between the global context versus the national context. And clearly, yeah, someone was asking, what we can do to make sure the global north doesn't look into the global south in a way that takes over and not really considering that. I mean, I think there are lots of lessons that can be learned between and amongst countries, but certainly the local expertise needs to be the driver for what might be the best way of translating research locally. Would any of you would like to expand a bit on how to best tailor the research at national level to align with what might be the global policy for better translating research? Vivian, maybe?
One of the best examples, sitting in Asia, I see two great examples in both China and Thailand in terms of countries that have really built their own networks. Now, one of the things when you work in the Asia Pacific is you have this huge diversity of languages, and policymakers are not going to read English. They want, materials in Thai, in Chinese, in Cambodian, etc. So perhaps this is, part of the commitment to, in fact, build local institutions. In the case of China, it was a very early investment by the World Bank to build a health economics institute. But then that led to a whole network of health economics and now health policy and systems research. So I don't think there's anything you can do you can't get away from the importance of local institutions. Now, some countries are very small, so then you start to think about regional institutions. So if I'm looking at the small Pacific islands, you might think about how do the Pacific islands as nations and also, regional universities come together, and you can think about this in other parts of the world. So I think that we do need to look at collaborative models. We could look at twinning arrangements to start with, where country with greater capacity and similar culture could be working with, and language working with another country. But I think building local capacity is absolutely the key.
Thank you. I think, yeah, that's a great insight. And how, I think another question that's been in the chat is, how can we look at individual contributions versus the collective contributions? I think we've been mostly discussing how collectively, in terms of organizations and communities, how can we advance research, translation. Individually, what as an individual can we do from where we sit, from the different sides where we sit? Joseph, maybe you could address this one. What could be the individual contribution as part of the society? What can we all do to improve?
So thinking about my role as an educator in a medical school, I think certainly, for the students that I interact with, letting them know the importance of really, taking every opportunity, every privilege that we have of interacting with a patient or with a member of the communities that we sit in, taking those opportunities to really provide health education in an understandable and consumable way, and going back to a point that Vivian made, I think really ensuring that our education systems, now and into the future, really work to get young people excited about science, about research, and then also, understanding that the knowledge that we create and the knowledge that we generate here, the science, that is generated here in the U.S. is a small part of the global ecosystem of information and science, and we definitely need to be better about considering the global evidence base and seeing how can we take evidence that's generated elsewhere and potentially adopt that to our local context here. So as an educator, there are many ways that we can try to advance the future of science.
Fantastic. Neil, would you like to chip in here?
Thank you. Yes, just to say that part of the challenge, I think, is to, as I was saying earlier, to strengthen the global evidence ecosystem. And I would say that everybody has a role in this, whether you are a health worker, policymaker, or a patient, or whatever. And the way that HIFA works is that we bring together all people who have an interest in evidence-based practice and evidence-informed policymaking, so that we can each bring our individual perspective, whether it's based on experience or expertise, to try to better understand the global evidence ecosystem and where we can help to improve it. hopefully, as I said earlier, with leadership from the World Health Organization, or should I say advocacy from the World Health Organization. Thanks.
Fantastic. Thaisa, would you like to take on the conversation?
I do have a combination of two questions in the chat that I think that will make a good topic for us to discuss. So there's a couple of questions about how this looks like in low and middle income countries and minoritized populations, and how do we make sure that the evidence that's being considered for policy making took under considerations the participation of minoritized populations into it, and how do we go for it? If it was not, what should we do and how should we be approaching this? It was not directed to anyone specifically, so if anyone wants to jump in and answer this.
So that is a really important question about, and I love Neil's phrase, the global information ecosystem, about participation, right? I think it's incumbent on all of us to make sure that we have as diverse as diverse a participant base as possible, and that's particularly important when it comes to science and to research studies and to clinical trials. It's incredibly important to make sure that the evidence that we have, was created with with diverse populations in mind. We have seen historically, some of the dangers of taking scientific evidence generated for one group of people and sort of applying that blindly to a more diverse population. And one of the ways that we can ensure that the evidence that is generated is generalizable to more people is to ensure that we have more diverse participation in clinical trials. Of course, one of the challenges there is one of the reasons that particularly minoritized members of minoritized groups have not participated more in clinical trials is because of some historical misconduct and mistreatment of some of those minoritized groups. And so, we definitely have to continue to, as a scientific community, continue to atone for that mistreatment, and always be mindful that we have to continue to be trustworthy as scientists, so that we can have more participation from diverse communities.
Yes, thank you.
I think in many ways.
Oh.
Sorry, I was just going to say that.
Please go ahead.
Okay, it's very important that research funders as well as decision makers are held to account by multiple interests. So, it took a very, very long time before clinical trials started to include women. Now, that seems quite obvious that, men and women biologically are different, yet it took long time before. So there's an advocacy exercise involved here. In Australia, Aboriginal people really resented researchers who had come in, taken samples, went away, they never heard from them again, don't know what happened. And then as a generation of people from the community became highly educated with PhDs, it was time to take control of the research agenda, and really get that focus. You know, and I think others could very easily argue that if you're implementing interventions that have not taken account of diversity, it's very wasteful, not to mention inappropriate. So I think it really is a matter that we need a coalition of people to really work together and monitor. Yeah.
Well said, Vivian. Truly, 100% agree with you. Thais, if that's okay, I have noted another question that came from the chat, which I think we touched a bit on this, but maybe we could discuss a bit further. And it's about, again, how to balance political interest with scientific evidence. And the colleague in the chat was referring to the example of what we saw during the COVID pandemic, how often politicians really clearly political interest didn't really align with the scientific evidence. Any particular thoughts on how to address this and fill in this gap between political sciences and biomedical sciences? Please jump in if you would like to.
I mean, I think COVID is such a fascinating example of the scientists around the world connected really, really quickly. It's that same scientific information that went everywhere, yet we have had as many different policy responses as we have countries. So clearly there's no perfect calibration of this. You know, I think in the early days, people talked about the Asian exceptionalism, although that wasn't strictly Asian. It also included Australia, New Zealand, and the Pacific Islands. And in these countries, perhaps, I certainly know from earlier survey that WHO was a very strong brand in terms of community trust. And in quite a number of Asian countries, there was a strong technocratic and meritocratic leaning in government as well. So, and then of course, there was also the experience of SARS in a number of countries. So there were probably a number of different factors at play, which meant that the political interests were not wanting to make a wrong move, and therefore very, very cautious at the beginning. And I think probably the scientists were also, you know, quite closely engaged. They weren't just talking through the newspaper, but they were in the meeting rooms, doing the briefing, constantly updating. So, you know, it's not something that just happens overnight, but it's probably a culture that takes development during peacetime. But then, you know, we saw a year, you know, and a half into the pandemic. I think pandemic fatigue really hit, and a lot of political drivers, there were different political drivers in different countries, and that became more important. So it's a real challenge, and a lot of it goes back to good communication between the research community and the decision makers, and the communication with the community.
Anyone else would like to add to Vivian's thoughts? Okay. If not, we can move on. Thaisa, would you like to bring in another?
I'm going to bring in one question, but I'm going to twist it just a little bit, because to link with what Vivian was saying about COVID, I think it was a natural experiment, if I can say, for a lot of things to learn related to science and how we use evidence, and on another side, how we need to work on trust in science as well, and especially from the community side and this bridge. And there is a question in the chat that's specifically related to how do we approach that in the era of AI, and how to make sure that this dissemination of information in this moment where uncontrolled generative AI is growing. So I'm keen on hearing your thoughts on this, and how do you see this, if anyone has an opinion on this.
Yes, thanks, Tessa. I would like to be optimistic about AI. I feel that although there are dangers, that it has a huge potential to make a leap forward in terms of meeting information needs. We're already finding that using AI, we can get very good answers to basic questions. It will be some time before those answers will be available in all languages, and perhaps using means other than text to inform people. But I do feel that if people can trust in a regulated AI that is overseen by a suitable body, then it could be an instant access to information provided in their own language at a level that is appropriate for them, and that could help them in any particular moment when they need reliable healthcare information. So I like to hope that as it evolves over the next few years, it will make a huge difference, especially as, of course, more and more people are connected. So the connectivity issue is going to become less and less. I'm hopeful.
I think it is just not the AI, but it is the research on the whole. A lot depends on trust and the teamwork. I think these are the two main pillars of research. The trust and teamwork, not only within the research community, but I think it's from the end users, the politicians, the media. I think all have a role in that. The most important is the post-research availability of the, either the drug or the vaccine or the device, whatever it is. If the community believes that they would stand to gain from the research results, after the research is completed and the researchers leave, and the same holds good for AI also. I think people should believe that AI is going to help them, especially where you do not have access to, the doctors or, for that matter, any healthcare workers. So I think it all boils down to trust.
If I can just also add a comment, I think that AI will in many ways transform medical practice, transform research, and the importance of governance and clarity about what's in the black box and making all that accountable cannot be underestimated. The question I have, and I really ask this question because I'm not an AI person, I'm not an ICT person, is to what extent are we going to be driven by the English language material which is on the internet? And to what extent are we going to be missing out on, non-English speaking language? And indeed, communication is not just language, but it's also culture and many other, relational things. And I just don't have a sense of how we can make sure that AI is equitable globally and takes account of culture and context.
I fully agree that how we're going to move on from being inclusive with something that's so exclusive in the starting point is the key question that everyone's hoping to answer in the short future, because it's approaching. Vanya, do you have any other questions you want to put?
I think just to finalize, I would take on, there was a question on the chat about the role of publishers and journals in advancing the translation of research and making research more effective. We Lancet, as a journal, we definitely find this a very important aspect of the research, the translation and the implementation. And I have to say, we often discuss in the journal ways of encouraging more implementation research, which is not an area of where we see a lot of studies across the group of journals in the family. So definitely through webinars, we by all means look at the journal as a platform for discussion, not just a platform for informing, but a platform for advocate and discuss any issues really that can promote and improve medical research. So we certainly open for any suggestions on how we can improve the call and our own responsibility on making on contributing to advance implementation and translation of science is certainly acknowledged and is very important for us. So yeah, we always open to any suggestion. That there's always more we can do, certainly, and yeah, hopefully that's the International Day of Science tomorrow will bring in more discussions. I've seen on social media many other activities happening in the context of the UN Science Day, and certainly this should not happen just once a year. It should be a topic of reflection across the whole time. So I think with this, we are very close to closing to finalize our webinar. And I just have some thoughts, I think, to wrap up our discussion. I think what I hear is that we really need to work as a collective, and this means joint efforts from individuals, from organizations, from the government, from private industry as well. And we all need to improve in communication. Communication is always key, and in whichever language, with all language, really, it should be inclusive, it should be diverse. I think education is a very important pillar to move and improve research translation. The way we have to learn how to better frame the need of evidence-based research to make policy, and how to motivate policymakers so that, yeah, make sure we understand the motivation of policymakers to better frame the need for this evidence-based policy. And I think we need some better measurements of accountability, because research waste is not is certainly not of interest neither for the researchers, not for the community, nor for the policymakers, and nor to the funders. So we all come out losing if we don't make better use of the knowledge we are generating and the impact it's having in society. So I will stop here, and I'll thank you all for taking part today. Thaisa, I don't know if you would like to add your final thoughts, and a pleasure to be with you today. Thanks very much.
I just want to thank you again, all the panelists. Thank you so much, Vivian, for joining so late. We have a wide range of time zones right here with us today. So Joseph's really early. Thank you so much as well. And thank you, Padma, for jumping in. And all your contributions were very, very important for our REACH discussions today. Thank you so much.
Thank you very much.
Bye-bye.
Bye.
Bye, everyone. Thank you.